Hey, Guelph, it's Mayor Cam Guthrie here. Thank you so much for joining us today. And when I say us, we have a special guest. We have Helen Fishburn from the Canadian Mental Health Association for this area, a fantastic person. Hi, Helen, how are you?
Hey Cam, great to chat with you.
You too. Look, we only have a few moments here, but this is a great opportunity for us to maybe hit everybody up with some answers to three really important questions that people really should know about when it comes to our mental health, especially during this time. So, my first question to you is, what are we seeing in the community right now because of COVID?
Well, as you know, Kim, we've all experienced this past year, this past 15 months has been really tough. The regular things that we would rely on to support our mental health, actually, we can't do. Simple things like family dinners and going to the movies and going on a vacation, which all kind of replenish and recharge you. We haven't been able to do. And although we know that intellectually that's really important to follow public health guidelines and to keep everyone safe, it's been really hard emotionally. So because of that, we're seeing more anxiety, depression, fear, sadness, a lot of loneliness. And of course, people who were struggling before the pandemic are struggling even more. But we've really seen a pretty big baseline shift in mental health and addictions over the course of the last year, especially in our community. So we're really, really concerned about people. This third wave, of course, has been the hardest as well.
For sure. And Helen, I don't mind saying this out loud. I've struggled with it a little bit myself.
Who
I've
hasn't?
had these roller coaster moments, these highs, these lows, stuff I've never really experienced before myself. Again, I have no problem saying that out loud. And
Absolutely.
I,
We all have, Cam, right? We've never been here before. We've never been
yeah,
in a global pandemic. We've never experienced these kinds of restrictions before. And we've come up with some new terms, actually. One is panger. So that's pandemic-induced anger. People are
okay.
really sick of living in these restrictions. And the other one is languishing, which is that space in between, like you're not doing terrible, but you're not doing great. You're in this fog. So we've actually even come up with some new ways of describing our feelings right now because none of us have ever been here before.
Languishing. I would
Shame.
tend to agree that that's probably defining me several times. So thank you. Thank you. I now know the term for it. So what can people do? So here we've identified it. You're seeing it from a professional point of view. I'm seeing it. I'm hearing it from when people are calling me. I'm feeling it myself. Others that we know are feeling it. So what can people do?
Well, first and foremost, it's really important. Actually, this is Mental Health Week, so it's really important, both this week and then the weeks beyond, to really check in with yourself. First and foremost, right? When you're on a plane and the plane's in trouble, the oxygen mask comes down, you put the oxygen mask on first. Check in with yourself. How are you doing really? That's what my shirt says here, right?
Yeah. Yeah.
Really, how are you doing? And answer as honestly as you can, because we've all really struggled this year at one time or another. So if the more you're kind of aware about how you're doing, the better you can really address that and take some steps to change that. Of course, we always want you to check in on people that you love, whether that's within your own immediate family, people across the street, your colleagues at work. Building that network of care and support, it's part of what defines Guelph as being so exceptional, but it's really what we need right now, especially with the restrictions, to stay connected to each other. I think
Yeah.
also, like, the regular things we do, eating well, sleeping well, exercising, have never been more important. But also, Cam, if those things aren't working for you, and we all do them when we try to do them, if they're not working for you, then it's really time to do something different. Try something different, a different skill set, a different tool in your toolbox, and then, of course, reaching out to help. You can call your family doctor, you can call a counseling agency, you can call us at CMHA through Here 24/7. There are many, many opportunities for help, but certainly paying attention to that and keeping an eye on people to make sure that we're all getting the support we need is so important right now.
Yeah, and I think not that I'm an expert, but I would add that when you say people, it means all people because
Yes.
I'm seeing it in people my age. I'm definitely seeing it in my own kids that are teenagers.
Yeah,
I'm hearing it through to their friends, my parents, great grandparents, like it's all demographics, it's all
it
age
is.
groups. And so there's probably different tools for the different type of every individual really requires sometimes their own unique set of tools, but
That's right.
it's important for people to know that the help is available no matter who you are, what age, where you are. It's definitely they're there, and people do need to reach out. And the last question I guess I have is then it's a good segue. I guess I made a good segue here. Where can people get help?
Well, you're absolutely right, Cam, in the sense that each of us has struggled at different times and in different ways. And depending on your age, what works for a youth isn't necessarily going to work for your 85-year-old mother or neighbor. So each of us needs to look at how we can best be supported. We've actually created a website to help people get the support they need, and we've got some great articles and links to care and different tools. You can find all of that on Here for Help. So here, the number four, help.ca. Of course, everything is also on our CMHA website, cmhaww.ca. We are doing a ton of webinars to be able to help people learn new ways of coping, ways of handling stress and isolation, and all different kinds of, mindfulness, meditation, breathing, all kinds of things of which are going to just help people get through the next part of this journey. And of course, if you don't want to look on the you can always call us at Here 24/7, which is 1-844-HERE-247. One of our amazing service coordinators is always there, able to pick up the phone. We respond to people who are in crisis, and we respond to people who have questions. They're worried about themselves or worried about someone else. No matter which avenue you pick, there is help available. So please don't hesitate. If you have a sore tooth, you wouldn't hesitate to pick up the phone and call your dentist. So your mental health is just as important, and there are so many ways that we can help and support you.
Great. And might I just say here as we end, and I'll put up the links here for people and the phone numbers, as you said here, for people to maybe consider. I just want to say something to you that over this last year, you've been an incredible leader in our community alongside others. You've really been on the front lines to try to manage this situation as well. And I've actually heard quite a lot of great supportive comments and encouraging comments about the help that you, your staff, the organization has done to help people over this last year with the very things that we've been talking about. So the results are there for people if they do reach out. And so I really appreciate your time. And I hope this little chat maybe just plants a seed with somebody that they can use for either themselves or for others that they may see that may need some help as well. And we appreciate what
Thanks,
you're doing
Cam.
in our community. Yeah,
Thank
thank you so
you. I
much,
will
Helen.
say that that's been the silver lining of this pandemic, right? We have kind of a renewed empathy and compassion for each other
Sure.
because of everything we've gone through. So just one last reminder that although we can't let people into our homes right now because of the restrictions, we can absolutely let people into our hearts and bring them close. Feel that support and connection with each other is something so important in that right now. And thank you, Cam, for all your support and leadership as well.
Oh, well, thanks. Yeah, even you can even let politicians into your heart. It's okay.
Absolutely.
Yeah. All right. Thanks, Helen. Thank you so much. Take care.
Thanks, Kim. Take
Bye.
care.